Hello everyone, I am Ray Kenneth Ligan and I will be discussing about Leopold's maneuver. What is Leopold's maneuver? Leopold's maneuver, it consists of four systematic actions using abdominal palpation to determine the fetal lie, the presentation and attitude, the position and engagement of presenting parts. And also, Leopold's maneuver can also help to locate the best place to monitor the fetal heart rate. So the aim of Leopold's maneuver is to determine the fetal position and presentation by systematically palpating the gravid abdomen, which in conjunction with correct assessment of the shape of the maternal pelvis can indicate whether the delivery is going to be complicated or whether cesarean section is necessary. So the following materials and supplies needed in this procedure are pillows, wedge or a towel to place under the patient's hip, and of course a gloves if it is necessary. Before performing the following maneuvers to the client, you need to explain the procedure first. This will reduce the anxiety and will enhance the cooperation from the client. So second is to instruct the client to empty the bladder. This will provide comfort and will allow more productive examination. And also, distended bladder can obscure the fetal contour. So third is to have the client in a supine position with knee slightly flexed and place a small pillow or a rolled towel under the client's hip. This will relax the abdominal muscle of the mother, and of course, this will prevent aortocaval compression. So fourth is to wash your hands with warm water and wear gloves if in contact with secretions. Cold hands can stimulate the uterine contraction, and wearing of gloves will protect the hands from microorganisms or secretions. So next is to stand beside the client, face her so that you can observe the abdomen and palpate it, and of course to see the mother's reaction. Hello ma'am, I am Ray Kenneth Ligan and I will be your nurse for today. I will be performing Leopold's maneuver, and Leopold's maneuver ma'am, it is palpation of your abdomen to check your baby's position and your engagement of the baby or the presenting part of the baby. Now perform the first maneuver, which is the fundal grip. This will determine the fetal part lying in the fundus and presentation. Now stand at the foot part of the client facing her and place both hands flat on her abdomen. Now palpate the uterine fundus, determine consistency, shape, and mobility. So round, hard, readily movable parts between the fingers of both hands is indicative of head, while irregular, bulkier, less firm, and not well defined is indicative of reach. Now perform the second maneuver, which is the umbilical grip. This will identify the location of fetal back and determine the position. So face the client, palpate the side of the uterus, hold the left hand stationary on one side as a support, while the right side will palpate the opposite side of the uterus from top to bottom. Then hold the right hand steady and repeat the palpation using the left hand on the left side. So firm, convex, continuous, smooth, resistant muscle extending from breech to neck is indicative of fetal back, while small knobs, irregular mass which move press is indicative of fetal small parts or limbs. Now perform the third maneuver, which is the pollic grip. This will determine the engagement of presenting part. So if the fetal head is above the pelvic brim, it will be readily movable and ballotable. Now palpate the suprapubic area, gently grasp the lower portion of the abdomen just above the symphysis between your thumbs and your index finger. So determine if the presenting part is not engaged. The grasping movement of the finger moves it upward in the uterus. Now perform the fourth maneuver, which is the pelvic grip. Determine the degree of flexion of fetal head and attitude. Now face your client's feet. Place your hands on both sides of the uterus with fingers pointed towards the pelvic inlet. Now slide hands downward while the other side will slide on the upper edge of the symphysis. So if the hands converge on the presenting part, the head is not engaged. If the presenting part is engaged, there will be no mobility. So that's all for today. Thank you for watching and goodbye.